Chronic otitis media. What is chronic otitis media? It is the permanent abnormality of the tympanic membrane, and it can be of two types. It can be of mucosal or squamosal, and this mucosal is going to be explained in this video. The mucosal chronic otitis media is known as tubotympanic, or it is called as safe type. Next one is, this is the introduction, and next is, it can be of active or inactive. Active means active infection is present. Inactive means no infection currently present. That is no discharge and all. Okay. Then what will be present in chronic mucosal otitis media? There will be perforation. Okay, this is a tympanic membrane, and there will be central perforation, and central perforation be of any type, anterior, posterior, or any type. Okay, and this perforation present, this one is the pars flaccida, and this is the pars tensa, and this perforation occurs in the pars tensa, and it should be central. And this perforation can be due to acute otitis media or due to any trauma. Okay, usually this perforation will be healed by 3 months and all. Normally perforations will be healed by 3 months and all. If doesn't healed by 3 months, it will lead to chronic otitis media. Okay. Then what is the clinical feature? What will be the clinical feature? Think about 3 P's. One is, there will be profuse discharge, and this discharge will be of mucoidal or mucopurulent discharge. Next P is, it will be painless, and it will be painless. And next P is, this is a mucopurulent. Okay, it will be mucopurulent, purulent, profuse, and painless. Okay, first one is discharge. What is the other feature? Deafness, because as the cavity, this is the cavity, and it has ear ossicles present. Okay, so if this cavity is filled with fluid, the conduction of sound will not occur properly, right? So there will be deafness. Next thing is necrosis. That is, whenever there is an infection occurring, this can lead to necrosis of the ear ossicles. So it will also causes deafness. And here the most common area where necrosis occur is lenticular process of incus. Okay. Next one, regarding the management, first thing we have to check is, local application of medicine should be given, like antibiotics can be given in order to prevent infections and all. And next thing is oral toilet. The ear should be cleaned, discharge should be cleaned, and everything should be kept clean. Next thing is surgical repair. Okay, so the thing is, if the tympanic membrane only have any issue, perforation, and we repair them, and it is known as myringoplasty. And if there is necrosis present, and we have to repair the ossicles, okay, then it is called as tympanoplasty. Okay, so in order to do myringoplasty, first the secretion should be stopped. That is, it should be in inactive phase. So after giving antibiotic, we give antibiotic for 5 days or depending upon the course, and after 5 days we calculate up to 6 weeks, and after 6 weeks only we can do myringoplasty. Okay, and if there is necrosis, we have to do tympanoplasty. Okay, then how can we check whether the perforation is present or not? This is a simple test known as patch test. What does this signifies? If we put a patch over the perforation, this will lead to closing of the tympanic membrane. The patient have deafness because of the perforation of the tympanic membrane, right? So if the tympanic membrane got closed, what happened? The hearing will, or deafness will decrease. Okay, but if the patient have necrosis also, and if we close the tympanic membrane perforation, what happened? The patient deafness will increase, because It is because the perforation is the only way which help in entry of the sound waves into the canal, right? Into the cavity, right? So it should be checked. That is called the patch test. This is called otoscope. Using otoscope we can see the perforation. Next one is surgical. The importance of this thing is if the we have to check whether the patient have any ossicle necrosis and all before we conduct myringoplasty. Otherwise, if we close the tympanic membrane, it will increase the deafness. So we have to check that. Next one is surgery. So in surgery, we usually do post-oral incision. Okay, that is behind the pinna, and it is also known as Weil's incision, and it is given externally. Other incisions are also present. We can give incision in the incisura terminalis, or we can give Rosen transconal incision. Okay, it is given inside. The next one is the graft. Which are the graft we use for tympanic membrane surgeries? Main thing we use is the temporalis fascia. There are mainly 5 types of tympanoplasty, and before that, this is the erosical. This one is the malleus, this is the incus, and this is the stapes. And at the stapes is attached to the oval window, and here is the round window. Okay, so type 1 tympanoplasty means for the repair of malleus, that is the graft is kept at the malleus, type 2 at the incus, and type 3 at the stapes. It can be of partial or total. There are 2 types. Okay, then next one is type 4. Type 4 means it is kept at the round window, that is below the oval window. Okay, then type 5 is fenestration type. Here we put a perforation in the lateral semicircular canal prominence, and this is not usually done. This is the treatment for mucosal otitis media. Thank you.